welcome to Health Check. I'm Claudia Hammond. This week, a problem which affects millions of people around the world, but many are too embarrassed to get help for it. Doctors in London are pioneering a new technique of treating hemorrhoids or piles, which are swollen blood vessels in the anus or bottom, and it can mean that people recover more quickly. Simon Danziger experienced symptoms for a while, hoping the piles would clear up by themselves, but he wasn't so lucky.
Very uncomfortable. Sitting down wasn't at all pleasant. When I went to the toilet, that was sometimes excruciating, and the pain became progressively worse. And there came a point when I started to bleed when I went to the toilet. And in fact, I had a couple of occasions where I was bleeding even when I was just walking around the house. And I think that was the point when I thought I need to go and get something done about this.
Piles or hemorrhoids are dilated anal cushions. They're an incredibly common condition. They can, as they get bigger, bulge inwards into the anal canal, at which point they typically cause itching and bleeding. And as they get larger still, they can hang out of the bottom, and this is where they produce their classical symptoms of prolapse and bleeding. There are two mainstays of treatment. Simple hemorrhoids can be treated in the outpatient setting by injection or banding, or sometimes by dietary modification. But where they're large and they prolapse or hang out of the anal canal, then they often need surgical treatment.
Operations to remove the piles or staple them inside the body both involve cutting. The recovery time is long and can be very painful. Mr. Buchanan prefers to use a new technique he learnt in Italy.
This is the Thd device, and when this device has been lubricated, it's positioned inside the patient's bottom. On here, this black point denotes the ultrasound, and I'll just turn on the device, and when there is an artery over the top, one will detect the sound of the artery. Once it's in the correct position, the surgeon can then place the needle internally and then pick up the artery by stitching it, which is undertaken. And once he's secured the artery, this device then slides back, and as it slides back, the surgeon can take further stitches internally, and this can then lift the tissue back into its normal position.
The new technique restores the patient's anatomy and involves no cutting, and it seems to be virtually pain-free.
I was attracted to the experimental procedure because the consultant said that I would be up and about on my feet much more quickly, and as a keen runner I was really keen not to miss any training, so I didn't have much hesitation in going for that option.
So were you nervous about having a procedure that is, after all, experimental?
I don't think I was any more nervous because it was experimental. I was probably as nervous as anyone is going into a hospital. I've never had an operation before. I'm sort of 47 years old, and this was the first time I'd had this conversation, with a consultant. But no more nervous because it was experimental.
This is, in the world, a relatively new technique. It's only been around for a couple of years, and we've started doing this here for the last 6 months. We've treated 35 patients. The majority have been day cases. They've gone home from hospital the same day, and 60% of our patients have reported returning to full activity within 4 days.
I felt fine. Once the anaesthetic had worn off after about 24 hours, I was up on my feet, walking around. There was no discomfort, and within 48 hours my running shoes were on and I was off training.
That's it for today, but if you've enjoyed this bite-sized version of Health Check, you can catch our radio programme over on BBC World Service. More details at bbc.com/health. But until next week, it's goodbye from Health Check.